All right, everybody, welcome back to another episode of Honestly Bilal. I'm your host, Bilal Ahmed, and I'm a fourth-year medical student at the University of Toledo. And this is Honestly Bilal, the show for the aspiring ophthalmologist, where I sit down and talk to medical students who are interested in ophthalmology, residents who are currently training in ophthalmology, and current ophthalmologists in the field today. And today I'm joined by my guest, Dr. Danny Moore. Dr. Moore is the Residency Program Director at the University of Kentucky, and he's also an associate professor, and he's a glaucoma specialist here at the University of Kentucky. And right now we're across the hall from each other. I'm in an empty office, and we're Zooming with each other, trying to practice our Zoom interview skills and try to share some stuff about UK while I'm here on this away rotation. So, Dr. Moore, thanks for joining me.
I'm happy to be here.
Yeah. So it's been a fun month so far. I'm on week number 3 and finishing up the 3rd week, about to start week 4, and it's been cool. You know, just seeing a program in person. I think that's one thing this year we're going to be missing out on a lot of places without real interviews and stuff like that. So I do have to put in a plug for the program. You know, great residents here. Number one thing about this place, I'll tell anybody who's out there who's thinking about UK, is that the culture here is unbeatable. I mean, I don't think there's a place where, from not only the faculty and the residents, but also the staff and, you know, people when it comes to the janitorial service or people in the cafeteria, everybody here is friendly and welcoming. So I really appreciated that. And it's nice that you can, I got lucky enough to be able to see in person. So definitely putting the plug for anybody who's thinking about UK, put it up there in terms of places that you want to apply to. So anyways, Dr. Moore, let's get to your story first of all. So,
thank you. I slid the money under the door for you.
Yeah, he paid me already, so it's all taken care of, and use that cash later. So Dr. Moore, you did med school at IU, Indiana. You did your residency at the University of Washington in Seattle, and then you did a fellowship at Duke. So what brought you to Kentucky, and then also what got you into ophthalmology in the first place?
Yeah, so the geographic one's relatively easy. I'm originally from Indiana and knew I wanted to go into academics. I was very fortunate to be able to train kind of on both sides of the country. And my wife and I realized we wanted to be back closer to home and closer to family. And so picked out some academic centers kind of in that region, and UK was one of them. And not to overstate it, but when I interviewed here, I did see and feel that cultural vibe. And so that was one of the things that drew me here. But a lot of other things as well, and ended up being a good place. And obviously I've stayed, and it's been a great environment. Why ophthalmology? You know, that's a common question that we'll be asking all the applicants this season and every season on the interview trail. And you get quite a variety of answers. I think the common answers do apply to me too. You know, I want to do a surgical subspecialty. Sure. I want to do a subspecialty where you still get to do some medicine and practice medicine. You don't give it up entirely. Right. Something where you do get some longitudinal care for your patients, so it's not just do the surgery and walk away. The inside the eye approach, all the surgical techniques, the evolving nature of technology, you know, all those kind of things drew me initially. Not to belabor it too much, but it was interesting. I was talking to a colleague this weekend who's in internal medicine. We were going back and forth about the same exact question. Mm-hmm. And part of it for me is just luck. My ophthalmology rotation was the very first rotation I did during my 3rd year of medical school, and I fell in love with it. And, you know, reflecting back, I was telling my colleague that had I had at the end of 3rd year, I'm not sure I would have felt the same, because you don't do much as a med student in ophthalmology.
That's true.
And at the beginning of 3rd year, I had no idea. I didn't do anything anyway, but I'm in the clinic. I get to see people. It's really cool. And had I gone through a whole year of actually doing things, then go to ophthalmology and sit there and watch someone else examine a patient, it might have been different. But,
yeah, that's fair.
But it worked out the way it did, and I'm very happy it did.
Awesome. And then you obviously specialize in glaucoma, and I was with you in clinic just a couple of days ago, and I noticed that, you know, you definitely take care of your patients, and I think it's cool that you can balance. The thing about academics is that you can balance research and teaching and then patient care, and it's nice that you have your foot in a little bit of everything. So I think it's kind of cool. So let's talk about the program here a little bit. University of Kentucky. I think it's one of those places that people may not know too much about at the University of Kentucky, just because it's, you know, there's so many programs to think about, and you know, in a year where everybody's trying to get on a little bit of the social media train a bit here and there and try to, you know, market their program. For those people who have not seen the University of Kentucky's Instagram page, it's really great. I recommend that you look at it, and there's some really great stuff out there you guys are doing, and some new initiatives. So talk about what makes you excited about the University of Kentucky, and what makes this program somewhere that, you know, is unique and a place that people should really take a chance to do some research about.
Yeah, to your point, I grew up in the adjacent state and really didn't know anything about this residency program or even about the program in general when I was applying. So I do think this is not necessarily overlooked, but it's definitely a hidden place for many. And want to emphasize that I don't think UK is unique and the best place and the only place to go. I think applicants this season, one thing to take away is all the programs are excellent. Wherever you end up matching, you're going to get really good training. The program directors to a T are very invested in exciting people who are excited to do what they do. So I don't want to make any of this conversation seem like UK stands out as the only place, but of course it's ours and we're very proud of it. There are a couple initiatives that are new and I think exciting. One that I do believe is entirely unique to our program is that we are offering a global ophthalmology tract in residency. So there are multiple institutions that have global ophthalmology fellowships that they offer post-residency, but we're actually offering a position throughout residency as an opportunity to really hone that if that's something you're interested in. And that's an outpouring of our Global Ophthalmology division that just started a few years ago. Dr. Ana Bastos is the head of that with several other colleagues. And the initiative is both an outreach internationally, but also half of the time of outreach is spent here locally. So the notion that you need to go somewhere else in order to reach people in need is one that I think is important, but we also recognize that here in the Commonwealth, in the state of Kentucky, we have a lot of underserved patients as well. Absolutely. And so it's that synergy between the two, that the efforts we put in here can translate to efforts elsewhere, and the things we learn elsewhere we can bring back here. So that's one of the major overarching goals with this initiative. The other is that outreach isn't necessarily us going somewhere and us providing things and then leaving. It's a partnership where we aren't going to do surgery. We're going to help an institution. And in our case, the one we're partnering with is in Ecuador as they're starting a residency and academic program. And we're going to work alongside them and share resources and opportunities together. And so that notion of working alongside of instead of coming into is I think, an important part of this. And that's really the focus of the Global Ophthalmology Tract for our residents. It's a 3-year, really starting an internship, but it's essentially a 3-year longitudinal program where you learn about global ophthalmology. You have different metrics you perform, you have research projects, and then you ultimately end up partnering with an institution and spending up to a month in your senior year at that institution.
Right. And again, like you emphasize that while while many programs have global health opportunities, this is the first in the country, according to Dr. Bastos, that is actually a track specified for your training that you follow along all 3 years. So very unique and something that people should be on the lookout for. And you can check it out on the website that the program has. And Dr. Moore can give that link towards the end of the interview.
Oh, and one more thing before I forget, this isn't something you would match into. So it's not a position you match into our residency. It's something that after you've matched, if you're interested, we would discuss with you. So if people are interested in that, definitely look us up, but don't feel like it's something you have to specifically designate.
Absolutely. Yeah. And I will tell you this, for somebody who's talked to the people in charge, Dr. Higgins and Dr. Bastos, both, they're the head of the program, and they've been very, very open about the whole process, and they're very excited about it. So if you're interested in global health, definitely check it out. And if it's something you want to do early in your career in terms of your training, it's a great opportunity. So anybody who's out there who's thinking about global health, look at University of Kentucky for that too. So Dr. Moore, let's talk about, we talked about some exciting things that are happening at the program. What do you look for specifically as program director? Who are the kind of people who fit into the program here? I mean, I can tell you from the residents I've interacted with that they love to teach. They're very open and understanding about everybody's learning curve and everybody's starting point for the most part. So what do you look for when you're thinking about who do I want to bring to this institution over the next 4 years, and who do I want to train?
Yeah, I think some of the biggest things for people who succeed or do well in our program, one is initiative and not necessarily independence, but a desire to do things and to follow through with them. Because as program director, I really encourage residents to take ownership. And whether that be with your patients on call, with patients in the clinic, or with projects. A lot of our research and quality improvement projects are initiated by the residents. Although we have multiple ones that the faculty are providing, I think that residents who start things on their own and follow through with it, this is an environment that allows that. Our chair from the top down fosters that kind of an environment where people are encouraged to try to do things on their own and seek it out and to provide resources for that. So if you're the type of person who wants to try things and wants to have that more independent streak, I think this is a place where you certainly can strive. Certainly excel. We also have a very structured curriculum. It's a matriculation process, much like every other residency program. You're not out in the Wild West doing things on your own, but there is some leeway for initiative on your own. we have a very, as you alluded to, collaborative environment where faculty, staff, residents, everyone is trying to work together. There's not as much hierarchy. It's more linear, although of course there's always going to be some level of hierarchy.
Sure.
And so residents that want to work alongside and work along with faculty and fellows and each other, I think do really well here as well.
Yeah, and I'll say this, I definitely have gotten the feel that the residents really hang out with each other and gotten to know each other pretty well while they've been here. So, you know, they know by each other's lives, and they know, you know, each other by first name basis, and they're friendly with each other. And I think the cool thing is that you don't realize until you go to a place is kind of like, it's nice to know the kind of breadth of variety of different faculty. And I know that you guys are, you know, you have every department here has a specialist, and you're actually a new uveitis specialist is coming to the department in just a few days. So I think that's another exciting update you guys have going for the program. And, you know, so there's definitely a lot here to work with. So in terms of just, you know, as obviously, you know, you're you're program director of University of Kentucky, but as a program director in general, do you have any advice for applicants who are applying to ophthalmology this year about how to go about, you know, just your applications or even the virtual interview process, you know, because I think there's a lot of uncertainties and anxieties that people have about all of it. So what do you think is something to keep in mind that maybe if you were in our shoes, you would probably focus on more in terms of going about the next few months?
Yeah, I just want to let you know I feel for you all as much as I can in my position that the application process in a normal year is anxiety provoking. And this year with so much uncertainty and with things changing frequently as everyone's trying to adjust, it's very difficult. So off the bat, I just want to offer that. So, and I also want to say that the program directors that are in charge of this with the AUPO are working very, very hard and earnestly to try to adjust and to try to provide the best experience for everyone. And they're actually volunteers. These aren't paid positions. So the ones that are helping to guide us through this process are doing an incredible job in very difficult circumstances as well. But as you mentioned, you know, being at an away rotation where you can experience the environment and actually see folks is great, because you don't get what the program shows you on the day of your interview. You get the real program because you're there for an extended period of time. Right. And under the best of circumstances, that can be difficult. You know, if you're doing an in-person interview and interacting with folks, you may get a sense for what it's like, but you also have to take into account that they're showing you what they can on an individual day, including our program. On a virtual interview, that's going to be even more difficult. So things that we're going to try to highlight as much as possible, and I imagine other programs are as well, that you should pay attention to, is the amount of time and what your interactions are like with the residents. So whether they're trying to have some kind of Google Hangout or some kind of Zoom session with the residents, really try to emphasize and spend as much time with them as possible, because they're going to be the ones that give you the best feel for the program. So as you're interviewing, I think that's really important. As you're going through the application process, traditionally our field hasn't been the best with websites and updating things. And so with all the changes that have occurred this year, I hope and I think we're doing more to be diligent with the information that we're providing. But you're seeing, I think, more effort and emphasis towards social media and having some virtual opportunities for town halls and things like that. And so as much as you can engage with those, I think that's better. When you are looking at websites or the information on the SF Match, I don't know if there's a best way to do so, but make sure it is up to date. I was talking to a student just this morning who said he went to a website and their application deadline was August 15th, which clearly that's outdated. Yeah. So I think that's going to be difficult, is trying to make sure you're getting the most accurate information. But where possible, doing that I think will help too.
Sure. Sure. And I want to, you know, remind people who, if you're interested in University of Kentucky, just keep in mind there's a supplemental application, 400 word, just type up of why, you know, why Kentucky specifically, why you would want to go here. So if you are interested in program, just make sure that you also do the supplemental application part, and just make sure you specify why this program is great for you. Dr. Moore, it's been an absolute pleasure. I've been bothering you for a couple of weeks about doing this with me, and every time you've been like, yeah, we'll do it for sure. So you've been really kind. I do want to tell a funny story. For anybody who's been following my journey at all, this kind of whole process has been definitely a journey with everything going on with COVID-19, and my away rotation was mistakenly canceled at the University of Kentucky from the registrar's office. So I had just made a professional Twitter account. So I just tweeted about it, and I said, hey, if anybody can help me, it'd be great. So I tweeted out the email, got a massive response from people on the Twitter community, and it became a little bit of a platform for me to start helping other students. So I made this show, and then somehow Dr. Glaucoma Flecken saw the tweet, retweeted it or something. And then Dr. Moore saw that, and then Dr. Moore fixed the whole situation. So basically, this show wouldn't have happened without Dr. Moore and Dr. Glaucoma. So cool team up there. And then also, I will say that Dr. Moore has been a really chill, laid back guy. When I first came into your office, I remember, I don't know why I remember this, but I just know the first thing I noticed is that you were listening to the XX. I was like, all right, this guy's cool. He was listening to the XX, and he had his plants in his office. I was like, all right, cool. I feel at home here. This feels pretty chill. So, I think you've clearly created a great environment here for people to train and feel like they're, at a place where they can learn and just, take ownership of their own learning, like you mentioned. So looking forward to seeing what happens for you guys in the coming year. And anytime you want to come back and talk about UK, there's just a place for you to be welcome to.
Yeah, and thank you for this opportunity and for doing things like this. We've been talking about what programs are trying to do to get to medical students and applicants, and you're doing the exact opposite, which is just so admirable and important. So thanks for getting this out there.
Absolutely. So, and then if people want to look at the Instagram page for University of Kentucky, there's the UK Ophthalmology Instagram page. And then there's the website for University of Kentucky's ophthalmology program, where you can even look at some of Dr. Moore's program director musings. So where he writes about different topics, including things about racial disparities and what the program's doing to address those, as well as some of the, opportunities for IMGs about what they should be doing for the application cycle, and as well as some information about the global health program. So if you want to go to ukyophtho.edu, I believe, then that's the website. Is it .edu, Dr. Moore?
I think it's .com.
.com. Okay. So
yeah.
ukyophtho.com. So I will also include everything in the description for this video and in the podcast. So Dr. Moore, once again, thanks for joining me, and I'll see you in 5 minutes across the hall.
Yeah, I'll wave to you in a minute.
Okay, all right, bye.
Thank you very much.
Take care.